Bismillahirrahmanirrahim. In this video, we are going to talk about Propofol. Propofol is basically a non-barbiturate drug, and its mode of action is that it acts on the GABA receptors. It provides minimum to no analgesia. It is an oil in water emulsion that includes propofol, soybean oil, glycerol, and purified egg phosphatide. And when it is prepared and like commercially available, it does not have any preservative in its formulation. So it basically supports the bacterial and fungal growth. So once you open the vial to use it, you have to completely use it on 2 to 3 surgeries within 6 hours. Like after 6 hours, you have to discard the vial of the propofol, because rather than giving you any advantage, it will harm your patient, because it has such a high number of bacterial and fungal growth in it, that if you will inject it in the animal, you are basically injecting the bacteria, load of bacteria, so it will harm your animal. So never use after 6 hours, discard it. It is like not preferred or not used in cats. Why? Because the metabolism of propofol in the body of an animal is through sulfide or glucuronide reactions, and we know the cats lack glucuronidation reactions in the liver. So we do not use propofol or prefer propofol use in cats, and that is the same reason why paracetamol, we know, like it is contraindicated in cats, because paracetamol is same like propofol, undergoes glucuronidation reaction. So if you will inject the paracetamol, the cat will have that toxicity. Next we have is the effects of propofol on three major systems: central nervous system, cardiovascular, and respiratory. As far as CNS is concerned, it causes CNS depression and decrease in intracranial pressure. Again, this is important to know that it decreases ICP. As far as CVS is concerned, it reduces the blood pressure, heart rate, cardiac contractility, and myocardial depression. Next we have is respiratory depression, and it is very important to know. Propofol causes apnea, uh, and like respiratory depression, as well as transient cyanosis. But this apnea is most important, because as you will inject the propofol in the animal, straightforward 90 seconds apnea will happen, and that is very like a dangerous thing for like patient as well as the doctor or surgeon that is using this drug, because you have to be very careful. You should inject it slowly. You should inject it in a continuous rate infusion drip, like, because it causes an apnea, and these 90 seconds are too much. So you have to be very careful, and it has a profound effect on respiratory system. Next, it has effects on muscular system. It causes muscle relaxation, and it is best suited for procedures where good muscle relaxation is needed, like pelvic radiographs. Like if you have to take radiograph of an animal that is vicious, and you want to use chemical restraint methods, so you can have propofol. It will give you a very profound muscle relaxation, and that is good. Similarly, you can use propofol in orthopedic surgeries. Why? Because it will provide muscle relaxation, so it will be easier for you to reach the bone through the muscles, because the muscles will not be in contracted state like in ketamine. Next we have is a very important thing that you should know, that in dogs, when you will use propofol for induction, it will cause nystagmus, paddling, opisthotonus, because and you should know that these are the normal side effects, that these will not for sure happen, and you should not panic as a doctor that now what is happening to your dog. So clinically, induction, if you are using propofol for induction for any purpose, like for bone biopsy or for any surgery, it will cause these things. And in horses specifically, excitement is being or horse underwent excitement on injection. So you should know, and you should like tell the owner pre-handedly that this will happen, so they have not to worry, because this is a normal side effect that will for sure happen. So that was all about propofol. Thank you so much.